Hi, Dr. Michael DiMattina. Welcome to Dominion Fertility Facebook Live today. It is April 4th, Wednesday, and we're so happy to be here and very happy you're here too. You know, they asked me what I wanted to talk about today, and I said, life is good. And they go, what? And then I said to myself, life's better than good. Life is great. And then I thought about it some more, and I said, life is actually beautiful at Dominion Fertility. And I'm not saying this to pump us up. I love what I do, and the people here at Dominion Fertility love what they do too. And I was thinking about it the other day. You know, when I go see a doctor, I want them to care about me. I want them to have a personal interest that I get better. And, you know, I don't want the doctor to come in, spend 5 minutes with me and run out the door and that's it. You never see him. You place a phone call, you never get your phone calls returned. And you feel lost. I want information, I want to take part in my care, and I want to be able to make a decision that I think might be best for me, of course, with the doctor's professional judgment and direction. And that's what we do here at Dominion Fertility. We really care about our patients. I started this practice in 1987 with the intent we would provide the highest quality of personalized care in Washington for people who have infertility. And that's what we do. And we really love it. I don't even consider this a job, and that's why I'm saying, for me and for the people here, we don't consider it a job. We love what we do. And if you love what you do, then it's really not work. It is work, but it's not work. So what I wanted to do today is just tell you about us in more detail. We have made thousands and thousands of babies through a huge variety of technologies. We've had a world's first back in 1998 in our embryo cryopreservation program. We know that we have the experience after 31 years of making babies. We've led in many areas of infertility. We're one of the leaders in the United States, for example, in pre-implantation genetic screening. We're going to talk about that today. Embryo cryopreservation, the events that occurred, necessary catastrophic adverse events that occurred in Cleveland with the thawing of the embryos and in California. And we're going to tell you what we do so that won't happen here. So we already have a lot of questions, and I'd like to start by answering some of these questions.
What is the DF approach to a new infertility patient?
So the question is, when a patient comes to Dominion Fertility, what should they expect? We have what we call internally the Dominion Way. And the Dominion Way means that that patient's going to be having direct contact with their physician. The initial consultation takes around 30 to 45 minutes. We then talk about what's been going on. Have they had other testing done at other centers, other treatments done? What's their particular set of circumstances and situation? And then from there, we usually order a few tests, and then we have them come back for another consultation. But we maintain this continuity. And we let them know, we educate our patients because we think that's really important to educate the patient because we see smart people. The people in the Washington, D.C. area are intelligent. They have a keen interest in these technologies, their own personal health. And we believe that it alleviates a lot of the stress in their lives if they understand what's going on and what we're planning on doing. So that's how we do it. And the staff, I couldn't get a better staff anywhere. So the Dominion Way is that. Very, very hands-on, direct with our patients. We're very truthful, honest, straightforward, and they see it and they love it. So that's how we handle our patients, and that's how the technologies are treated. That's what we call the Dominion Way. Now, we'll be talking with more questions about specifics concerning treatments that we offer here, the Dominion Way.
Can you tell us about natural cycle IVF? It's compared to stimulated cycle IVF. Is one better than the other? How do we know?
So natural cycle IVF compared to stimulated cycle IVF. They are both great technologies, and that's exactly what they are. These are technologies that when used appropriately can offer a lot of hope and a lot of benefit to many infertile couples, and we know this. Natural cycle IVF produced the world's first IVF baby in 1978 in England. And in fact, this year in July, Louise Brown, that baby, will turn 40 years old. So IVF is not new. IVF has been going on since 1978 and is practiced in virtually almost every country in the world. I've been to China twice to lecture about natural cycle IVF, and they have some of the largest IVF centers in the world, which surprised me until I got there. The natural cycle IVF, the beauty of it is it's simple, it's easy for the patient, and it doesn't require any ovarian stimulation drugs. These drugs can cost up to $10,000 alone before you've even done a treatment. So with natural cycle IVF, you don't purchase the drugs, you don't take the drugs. The drugs are actually very well tolerated these days. They're used in a way where most patients do great with these drugs. But that's one of the advantages. People who have poor ovarian reserve, which means low egg count, so they don't have very many eggs, we often recommend to them they do natural cycle IVF, because why stimulate their ovaries when you're only going to get 1 or 2 or 3 eggs, when for no cost and no drugs we can get 1 egg from them from their normal natural cycle. And that's what we do. We monitor their cycle, collect the egg, fertilize it, transfer it. In fact, we have the oldest patient in the Washington, D.C. area pregnant with her own egg, and she delivered at 48 and a half years of age, the very first time I put an embryo in her using natural cycle IVF. Historically, that patient was at another IVF center and failed stimulated IVF when she 4 cycles of it when she was 41 to 43, and at 44 they told her to use an egg donor or go adopt. She didn't want to do that. She walks in at 47 and a half, and I suggested egg donor, but she said, I still have regular menstrual cycles, can I try this? You can try it, but less than 1% chance of getting pregnant. She won. She got pregnant, had a normal, healthy baby. We're really happy for her. We have a lot of stories like that in people in their younger 40s. She set the bar very high, but women between 40 and 44 often get pregnant from natural cycle IVF where other types of treatments failed. So we like to use it for that group. People who can't afford stimulated IVF is another group of people, or people who have failed stimulated IVF and they have no other option, but they still have regular menstrual periods. Yeah.
One of our ladies has a question. Amy wanted to know if you can do natural cycle IVF if sperm counts are low.
Yes, absolutely. It only takes 1 sperm for 1 egg to produce 1 healthy embryo. We do this all the time. I didn't comment about stimulated IVF. I've been doing stimulated IVF since 1984. In the United States, stimulated IVF started in 1982. Dominion Fertility clearly has the expertise and the experience to do stimulated IVF as well as any IVF center in the United States. And our statistics back that up. And I think you can find our 2016 statistics on our website, as I understand it. Yeah. And I invite you to look at those. We're really proud of them. We utilize a lot of PGS, which we'll be talking about, I think, shortly. Is there another question?
Yes. If doing stimulated IVF, can I get a fresh transfer?
The question is, when Dominion Fertility does stimulated IVF, will you be receiving a fresh embryo transfer? And the answer is no. Because there are many studies, scientific studies, and the evidence is quite clear, that if you take the embryo that is produced in the IVF cycle and freeze it and store it and transfer it outside of the stimulated cycle, the pregnancy rates can be as high as 40% higher than if you were to transfer the embryo fresh immediately when the embryo is produced. Why is that? Because the ovarian stimulation drugs are great for producing eggs, but they have an adverse effect on the lining of the uterus, making it so that the lining of the uterus is hostile to the embryo in 40% of patients. So if I have a patient who has only 1 or 2 beautiful embryos, the last thing I want to do is transfer them fresh. I want to optimize the likelihood that those embryos are going to implant, so I'll freeze them and transfer them outside of the stimulated cycle and give her a better chance of getting pregnant. Another question.
Great. Can you tell us about PGS, advantages, disadvantages? And it sounds expensive.
So PGS to me is one of the greatest breakthroughs in medical technology. This is where we test the chromosomes to find out if the chromosomes are genetically normal or abnormal. It is huge. We've been doing PGS for a long time. The major breakthrough with PGS occurred when we started biopsying the trophectoderm. The trophectoderm forms the placenta. Big words, huh? But it does not, we do not biopsy the fetus, where it will form the fetus, which is the inner cell mass. So the baby's not disturbed, not bothered. There's no risk to the baby whatsoever. PGS has to be done very skillfully. If the embryologist is not skilled at doing PGS, they ought not to do it. It does require a high skill set and a lot of experience in order to get good outcomes. What we do is we grow the embryos to blastocysts, biopsy the embryo, and then freeze it. And then the genetic laboratory tells us whether the embryo is genetically normal with 99+% certainty. That's huge. So it's like doing an amniocentesis before you put the embryo into the woman. She knows with 99% certainty that this embryo is genetically normal, and she'll have a normal, healthy baby, probably, at least from a genetic point of view. It also decreases the miscarriage rate tremendously and increases the implantation rate. I cannot get the pregnancy rates that we get here at Dominion Fertility, which are very high, unless we do PGS. In my opinion, the premier IVF centers in the United States and around the world regularly do PGS. I can't see any reason why not to do it unless the patient just doesn't want it done. And by the way, on cost, at Dominion Fertility, the cost to biopsy the to analyze the embryo per embryo is $150 per embryo. We have, if not the lowest cost in the United States, one of the lowest. And the reason why is because we helped validate the assay for PGS with the genetic company that we partner with, and they cut our rates as part of us doing the work in validating their assay, Good Start Genetics. So we're able to offer this at quite a good price to our patients. Some clinics charge as high as $400 per embryo. And that is expensive.
We did have a question wondering if there was a risk to the embryo when doing PGS.
The risk in terms of outcomes, to the baby are absolutely zero. If the biopsy is not performed properly, then the embryo can be damaged and it just won't implant or it won't freeze thaw properly. Fortunately, here at Dominion Fertility, we have just amazing embryologists. Our embryologists have tons of experience, many years of experience, and we do PGS every day. It's like if you're going to have surgery on your heart, you want a person who does it like 4, 5, 10 times a year. You want a person who does it 4 or 5 times a day or a week. I think I'd rather have the latter. And we have that here. We have the experience and expertise to do that.
Years ago I did IVF and I had to do these really bad progesterone shots. Is that still part of the protocol?
Yeah, these progesterone shots, Dominion Fertility has not used progesterone shots for about 10 years now. In our opinion, and in the vast majority of IVF centers, it appears to me that they use exclusively vaginal progesterone. Some use a combination of shots and vaginal progesterone. But vaginal progesterone gets absorbed extremely well, and there's just simply no need. There are Cochrane review articles and many articles from around the world showing that vaginal progesterone works just as well as intramuscular progesterone, and the intramuscular progesterone is no fun. That's a nasty shot. There is a vaginal prep called endometrine, which we don't use in our IVF treatment cycles until the patient's pregnant. And this came out, roughly 10, 12 years ago. And when it came out, the company asked us if we would use their prep, their vaginal prep called endometrine, in our IVF patients. Well, we tested the product, endometrine. We tested it with mouse embryos, and the product killed all our mouse embryos. So our embryologist said, Mike, you cannot use this in our IVF patients, and we did not. And that was it. Recently, there was a study, I understand, that came out where they were using endometrine, and sure enough, they were having problems in pregnancy rates and miscarriages. And we looked at that study, and we said, well, we suspected there was trouble 10 years ago. That's why we never used it. Vaginal progesterone, such as prometrium, what's compounded progesterone, and there's another prep out there, Crenone. These are safe, and they don't seem to have an adverse effect on the IVF outcome. Endometrine we don't use.
All right. What safety measures, can you tell us what Dominion Fertility does to protect the frozen eggs and embryos?
So, everybody in the United States knows that there was a catastrophic event with embryos that were frozen and stored in Cleveland and in California IVF centers. And I don't know what happened there. but that's just simply, you can't have that happen. It's like a surgeon going to the operating room, taking out the wrong kidney or cutting off the wrong arm or leg. You just can't allow that to happen. We have guidelines from the CAP, SART, and others, and our QA and QC here is way beyond that which is expected. First of all, in the morning, we check the embryo tanks manually to make sure the liquid nitrogen at the right level. And then again in the evening, the embryologists do the same thing. In the evening, when the embryologist checks the tanks, he then sends an email to all the other embryologists saying it's done. Then we have an alarm system on the tanks where if something happened acutely overnight, that alarm would go off and signal us on our cell phones. The equipment we use is state of the art. We maintain it. We don't understand what happened. We can't begin to imagine that ever happening to us. A horrendous event. We feel so sorry for the patients. We feel so sorry for the doctors too that this happened to. Lastly, I'd like to make a comment about a great resource at Dominion Fertility. We have a Dominion Fertility support group. It allows you to connect with other patients. It's a closed group, and the ladies love it. You can share your journey. You can expand your feelings with others. You can get ideas. You can do a lot of things. And, you know, I'm not a lady, but I'm sort of jealous. You know, I wouldn't mind being in that sort of thing. But, you know, you ladies have all the fun.
Girls only.
Yeah,
Girls only.
No
That's what I'm
doctors.
hearing.
No doctors.
Well, listen, it's been great being with you today. Dr. Dee Mattina, Medical Director of Dominion Fertility in Arlington, Virginia. Thanks so much.